So hello friends, so in my today's video I am going to discuss a case where a 60-year-old male patient having COPD that means chronic obstructive pulmonary disease, and this patient uses two medicinal drugs, Theophylline and Ipratropium Bromide, for a treatment of COPD. Now the patient also undergoes the following side effects along with the treatment, or the patient undergoes the following side effects due to use of these medicinal drugs. Now the following side effects are: the first one is the pain in epigastrium, second one is the restlessness and difficulty in sleeping, and the third one is the tremors of hand muscles and fingers, and the fourth one is the irritation. So these are the side effects caused. So in this today's video I am going to discuss that is what happens in COPD, and why the patient uses Theophylline and Ipratropium Bromide for the treatment of COPD, and third, that is what are the reasons for the side effects occurring in the patient. So please stay tuned. So friends, first of all I will discuss about COPD, chronic obstructive pulmonary disease. So friends, you should know that this COPD, chronic obstructive pulmonary disease, is a pathological condition. That means it occurs during a disease condition. Okay, now friends, see this diagram for understanding COPD better and what happens in COPD. See this diagram. So this diagram shows the airways of a normal healthy lung on one side and the airways of the lung affected in COPD zone. Now, and also by seeing the diagram you can relate that the airways in COPD, they are made narrow in comparison to airways of a normal healthy lung. As a result, that the entry and exit of the air becomes difficult. So as a result, breathing process becomes difficult in COPD. Now see, I have written that in COPD the airways like bronchial tubes made narrow with comparison to airways of a healthy lung. As a result, that it is difficult for air to flow in and out of the lung. So therefore breathing becomes difficult for such persons having COPD. So this is the main basic about a COPD or a situation what happens in COPD. Now I will discuss that what are two medicinal drugs used. So the two medicinal drugs which are used are Theophylline and Ipratropium. Now I am also going to discuss why these two medicinal drugs are used for COPD. But before knowing the uses of these two drugs and the reasons for their used, you should know that is how is, so here that is contraction and relaxation of bronchial tubes done. So friends, see this diagram, equation. So this is a bronchial tube. Now so here bronchial tube can undergo, so here dilatation also, and here bronchoconstriction also. See there. And this bronchial tube is made to undergo bronchodilation by the enzyme cyclic AMP. That means that this cyclic AMP causes the bronchodilation of bronchial tube. Whereas that these two enzymes, adenosine and acetylcholine, so that they cause bronchoconstriction. And also you should know that this cyclic AMP is synthesized by this adenyl cyclase, whereas destroyed by this phosphodiesterase. And also you should know that this synthesis and destruction of cyclic AMP occurs in a balanced manner, so that the whole, that is bronchodilation and bronchoconstriction, occurs in a physiological range. And all these portions I have written that cyclic AMP acts on the bronchial tube to cause relaxation of bronchial tube, so that bronchodilation occurs, and this leads to, that means that this bronchodilation leads to widening of the bronchial tube. So this is very important. So bronchodilation leads to widening of the bronchial tube. And also you should know that this cyclic AMP synthesized by adenyl cyclase, whereas cyclic AMP destroyed by phosphodiesterase. Next, adenosine causes bronchoconstriction by binding with adenosine receptors, and this bronchoconstriction also leads to narrowing of the bronchial tube. And acetylcholine causes bronchoconstriction by binding with muscarinic M3 receptors, and this bronchoconstriction leads to narrowing of the bronchial tube. So here basically important points are these which I have, that is underlined through the highlighter. and all the that is summary that I have discussed are shown here. That is widening of bronchial tube or bronchodilation, so here done by cyclic AMP, whereas narrowing of bronchial tube or bronchoconstriction done by adenosine and acetylcholine. So this is the main basic information about how is relaxation and so here constriction of bronchial tube done. Now I am going to show you the actions. So friends, see that now that this theophylline, so here that is inhibits the binding of adenosine with its receptor, and similarly the binding of acetylcholine with its receptor. As a result, the actions of both these substances reduce. So as a result, bronchoconstriction is inhibited. That means theophylline inhibits bronchoconstriction of bronchial tube by inhibiting the actions of adenosine and acetylcholine. So this is the first thing. And second thing, that as you already know that this phosphodiesterase, so here causes the destruction of the cyclic AMP. But this theophylline also that is inhibits phosphodiesterase. So as a result, that is destruction of cyclic AMP is inhibited. So therefore continuous or the bronchodilation is done for a longer process of time, or it is stimulated. So therefore that is widening of the bronchial tube is done. So therefore that this theophylline causes bronchodilation in the following ways. First, by inhibiting phosphodiesterase so that destruction of cyclic AMP is prevented, and second, by inhibiting the actions of adenosine and acetylcholine. So this is the main thing that I have written, that theophylline used for COPD, because in COPD widening of bronchial tubes becomes difficult. So theophylline causes widening of bronchial tubes by causing bronchodilation. And similarly, I am going to show you the actions of Ipratropium. So friends, see that is Ipratropium. So here that is inhibits only the actions of adenosine and acetylcholine. So this it only inhibits so here bronchoconstriction of the bronchial tubes. So automatically bronchodilation is done. So see that. So here Ipratropium causes bronchodilation by inhibiting the binding of acetylcholine and adenosine with the receptors. So therefore bronchodilation is done. And for COPD, Ipratropium also used as it causes widening of the bronchial tubes by doing bronchodilation. So these are the reasons why there is Ipratropium and theophylline used for COPD, because they cause a bronchodilation, and this bronchodilation leads to widening of the bronchial tubes, and in COPD that is widening of the bronchial tubes is not done. So it is done through the use of the medicinal drugs. So this is the main reason. Now I am going to show you basically the rough schematic diagram how adenosine works and does its action. So see that this is the adenosine and this is the adenosine receptor, and in this way that is adenosine, so here binds with its receptor. So this is the binding of adenosine with its adenosine receptor, and by binding that is adenosine, so here causes its action effects on the organs where it acts. So as you already know that is adenosine acts on bronchial tube to cause bronchoconstriction. Now also it also acts on different organs like stomach, heart and CNS to cause its actions. Now I am going to discuss those actions. So as you already know that actions of adenosine, that is adenosine does its action by binding with its adenosine receptors. And the first action, as you already know, that this adenosine acts on bronchial tube, and on bronchial tube that is adenosine causes bronchoconstriction. And this bronchoconstriction done in such a manner that the normal amount of air can enter and go out of the lungs. So in this physiological range, that is there is no problem occurs in the breathing, because that is bronchoconstriction and bronchodilation occur in a balanced physiological manner, so that no breathing abnormality occurs, and this happens in our that is normal and healthy person. Now that is the next action is on the stomach. Now here that is on stomach, so here it inhibits that is the gastric HCl secretion, but this inhibition of gastric HCl secretion also done in such a manner that the normal gastric secretion is done in the stomach, and that normal gastric secretion in stomach is 1.2 to 1.5 liter per day. So see, that is the second action is on the stomach, that is on stomach it acts, and on stomach it inhibits gastric acid or HCl secretion. And this, so here that is inhibition done in such a manner that the normal range of gastric secretion is done, and the normal gastric secretion is 1.2 to 1.5 liter per day. Now next action is on heart, and on heart you can see that this adenosine, so here depresses cardiac pacemaker. That means it hyperpolarizes the cells SA node. So therefore that this SA node does not respond to any electrical impulse anymore. So in this way, that is the heart rate is lower. And in my next video I am also going to show that how this lowering of heart rate done by this adenosine. But at present, just only remember that this adenosine acts on, so here heart, and on heart it reduces the heart rate by depressing the cardiac pacemaker, which is the SA node. So see that. So here on heart, that is to depress cardiac pacemaker so that the electrical impulse output lowered and the heart rate is also lowered. And also, and this lowering of heart rate is also done in such a manner that the heart rate, so here that is remains in a normal range, and the normal heart rate is the, so here that is 60 to 100 beats per minute. So this is the action on heart. Now here on CNS also, so here it reduces the excitability of neurons, and this is also essential for the, so here maintenance of sleep-wake cycle, for learning and neuroprotection. So this is the next action is on the CNS. So here that is to reduce neuronal excitability, and this is essential for the regulation of sleep-wake cycle, for learning, memory and neuroprotection. So these are the, so here actions of adenosine on different organs like on bronchial tube, stomach, heart and on CNS. Now, and this action when done in a normal and healthy heart, that there is no problem. Why? Because that in a normal physiological person, these actions occur in a balanced manner so that heart rate is maintained, and also so here gastric secretion, all these are maintained, and then this required amount of air can enter and exit out of the lungs, so therefore no breathing abnormality occurs, no problems related to acidity, no abnormal heart rate occurs. So these are the basic actions of adenosine. So these are the, so here actions of adenosine on other organs. So again, so revision, so that on bronchial tube, bronchoconstriction, on stomach, inhibition of HCl secretion, and on heart, reduction of heart rate, and on CNS, decreased neuronal excitability, so that, so here basically sleep-wake cycle maintained. So these are the, so here main basic actions of, so here adenosine on the different organs. Now, after knowing all these actions of adenosine on other organs like bronchial tube, stomach, heart, CNS, you can easily understand the causes of the, so here side effects occurring in the patient after using the prescribed medicines Theophylline and Ipratropium. So now I am going to discuss you the causes of the, so here side effects occurring in the patient after using the medicinal drugs. And the two medicinal drugs are Theophylline and Ipratropium. And the, so here side effects occurring in the patient are first pain in epigastrium, restlessness, inability to sleep, tremors of fingers and hand, and the number 4 is the irritation. So let's first discuss about pain in epigastrium. So cause of pain in epigastrium. So friends, as you already know that this adenosine binds with each adenosine receptor to cause its action on different organs. Now that it acts on stomach, and on stomach it inhibits HCl secretion or gastric secretion. Now, and this is essential so that the gastric secretion does not extend beyond 1.5 liter per day. If this extends beyond 1.5 liter per day, then acidity problem will occur. But normally that this doesn't occur, because when this gastric secretion that is extends or tries to extend beyond 1.5 liter per day, this adenosine so here inhibits its cell secretion. But as you already know that this Ipratropium and Theophylline inhibits the action of this adenosine. So therefore that this no inhibition of gastric secretion, so therefore gastric secretion extends beyond 1.5 liter per day to cause acidity, and this acidity problem so here cause pain in epigastrium. So see that this adenosine inhibits gastric acid secretion when the level of gastric acid secreted extends 1.5 liter per day, so that no acidity occurs. And this theophylline inhibits the action of adenosine, so excessive gastric acid secretion done, and so acidity problem occurs, and this acidity causes pain in epigastrium. So the first cause is that is acidity causes pain in epigastrium. And why acidity cause? Because theophylline so here causes excessive gastric acid secretion by inhibiting the action of adenosine, and the adenosine action is to inhibit gastric acid secretion. So this is the first cause of pain in epigastrium. Now again the next cause is so here that is restlessness and inability to sleep. So friends, as you already know that this adenosine acts on CNS, and on CNS it also reduces neuronal excitability, and this is also essential for the that is maintenance of sleep-wake cycle, and also that it reduces neuronal excitability in such a manner that our brain so here remains active during the daytime by responding to different stimuli, but on sleeping time that is our brain so here does not respond to any neural excitability because of adenosine, and then that is our sleep is done. So in this our sleep-wake cycle is maintained, but that this theophylline inhibits this action also, so therefore sleep-wake cycle is not maintained, so therefore problems related to a difficulty in sleep occurs and restlessness occurs. So see that this adenosine reduces excess neuron excitability so that normal sleep-wake cycle maintained, and this theophylline inhibits the action of adenosine, this action, so due to excess neuron excitability, restlessness and sleeping difficulty occurs. So this is the cause of restlessness and inability to sleep. So now I want to discuss so here tremors of fingers and hands. But before knowing the tremor, so here cause of tremors of finger and hands, so here you should know that this so here adenosine so here stimulates sympathomimetics drugs, and this sympathomimetics drugs so here that is cause sympathetic action, but this adenosine so here that is stimulates a sympathetic action so here that is in a rapid manner, so that is excessive or that is more sympathetic action is done, and due to more sympathetic action or due to increase in sympathetic action so here excessive muscle contraction of hand and fingers done. So due to this excessive muscle contraction of hand and fingers, tremors of hand muscles and fingers occurs, because that this sympathetic action is only occurring and no parasympathetic action is occurring, so therefore no muscle relaxation is occurring. So therefore due to excessive muscle contraction of hand and fingers, so here tremors occurs. So this is the main reason. So see that this where sympathomimetics cause sympathetic action, and this sympathetic action causes so here contraction of muscles, and this theophylline stimulates sympathomimetics. As a result, that is excessive contraction of muscles of hand and fingers done due to the so here due to sympathetic action, and then this excessive contractions of hand muscles and fingers lead tremors of fingers and hands. So this is the main reason for the cause of tremors of fingers and hand. Now again the last cause is about the irritation. So friends, as you already know that this adenosine that is acts on CNS, that is to decrease so here neuronal excitability so that sleep-wake cycle is maintained, and it gives relief from irritation. But due to inhibition, because that this theophylline inhibits this action, so therefore there is no sleep-wake cycle maintenance and irritation occurs because that is sleep-wake cycle is not maintained. So therefore I written that so cause of irritation because of excessive excitability of neurons, and this causes irritation. So these are the all causes or the reasons for the, so here that is side effects occurring in the patient by using the drugs, that is theophylline and ipratropium. So the main is a theophylline. So that's all.